Welcome to the M Word, Adrian Thompson, a certified physician assistant with over 20 years of clinical experience. Adrian is a Menopause Society certified practitioner. We're going to learn what that is, an expert in obesity medicine and sexual health. Adrian is passionate about educating, validating, and empowering women in midlife, helping them navigate perimenopause and beyond with confidence, clarity, and evidence-based care. Welcome, Adrian.
Thank you. I'm happy to be here. Thanks for having me.
I'm excited for this conversation, and I'll just say it right off the bat. This gives a whole new meaning to the M word. Uh, we are going to talk about menopause and women's health. But also, I really want to hear your journey from the business end of things to set the stage for us. What are you doing now, and how did you get there?
Yeah. So back in 2003, I was working a telemedicine job that I did really like, and I was happy about it. But I unexpectedly got laid off when they downsized, and I had had a couple difficult bosses in the past, and I was ready to do my own thing. So, yes, I was very sad to leave that job, but I thought this is the perfect opportunity to start my own clinical practice. So, I decided to kind of take what I love about primary care, cherry pick it, and start a practice. Yeah.
And so, was entrepreneurship something that was always in the back of your mind? When you talk to medical professionals, it's, you're drawn to your industry for lots of reasons that usually have to do with all, feel good, helping people. How did entrepreneurship like enter your
Oh my
psyche?
gosh. I never thought I'd be an entrepreneur or own my own business. That was not in my realm of thinking. I just knew that I needed something consistent that I could grow and that I could see my patients how I want to see them. I wanted to prioritize quality over quantity, and that's very, very hard to find in this day and age in medicine. So, I just knew it was the right thing to do. I have the clinical experience as a physician assistant to own my own practice. I can own it all on my own, but we do need a collaborating physician. So, friend of a friend is an internal medicine doctor here. So I met with him, talked with him. He does a lot of my same specialty. So I hired him to be my collaborating physician so that I can see patients, diagnose patients, write prescriptions, all the good stuff. So I do have a collaborating physician who, reviews my charts. We meet regularly, but he doesn't own any percentage of my practice. So it's my practice and I can see patients how I want to see them.
I think this tickles me more than anything I've heard you say. It's like it turns this assumption of hierarchy and control and authority on its head, right? Like in the traditional medical model, in the traditional medical economy, physician assistants who are highly trained medical professionals
Yes.
still are working for, typically, right? Uh,
Right.
a doctor who owns a practice or a medical group that's owned by a conglomerate of people. So this is fantastic that
This
you
is
get to
new.
be but does that create like a strange dynamic of just like interpersonal relationships when the doctor is certifying, right? So making sure that, whatever is, as you said, the prescriptions or whatever is like medically dictated is within whatever
Hmm.
rules or guidelines, right? But like
Hmm.
that's where their authority ends. So like is there ever a gray area where it's like that's a management decision, that's not a medical decision, or is it pretty clear?
It's been pretty clear so far. You know, he reviews my charts, will write up some suggestions, maybe based on my clinical findings or such. Um, and then we review it together. But so far, it's been a very wonderful relationship. He's supportive. He's so patient with me starting my own business and not knowing exactly what I'm doing, business wise. And it's gone great. There's not many managerial tasks that he has to worry about.
Right. So where do you, as a trained medical professional, get the skills to do the business side of things? Like how's that going?
Yes, so that was quite hard for me. I ended up going with a physician assistant business who does coaching for PAs in business. And so
Mhm.
I enrolled in their, I think it was called a practice blueprint. And I had a coach. It was a group of us, and it was, over about 6 months. And we met, I think, weekly. And I took a business boot camp from them that was all online, not live. And so meeting this weekly sessions, we could ask questions, we could feel proficient in what we were doing legally, medically. All our answer questions were answered. So it was quite nice. So I had a kind of a guiding hand to get it up and running.
That's great. I think, and I talk to a lot of entrepreneurs on this podcast, and there's a real mix, right? Those who at the start, like get that building block training and sort of the framework for how they want to operate,
Uh-huh.
not about their subject matter expertise, but the business side of things. And then the other, about half the folks are like, yeah, I'll figure it out as I go along here. But I would imagine that being in the highly regulated space that you're in, there's probably not a lot of room for not getting it right.
Exactly. There's more on the line. There's legal implications, my license implications. So I did hire an attorney who was familiar with PAs and nurse practitioners doing this on their own that kind of helped me manage the legal side of it. I practice in Virginia and DC right now. And so you had to make sure that this was a thing, this was okay, and all my structures were in place. And then all my forms were compliant, HIPAA compliant, privacy, telemedicine. There were so many other legal documents that I had to have to get started.
Yeah, yeah.
Yeah.
So talk to me though, because you were sharing with me when right before we started recording, you're launching a new brand. I mean, it's your business, but you are repositioning. How did that come about? Like what is this about?
So I originally started my business really wanting to take insurance. I was like, I want to provide insurance. I want to be available. I want people to have access to care. So it was really important to me when I got started to take insurance. The credentialing process with insurances is so, so hard and long and difficult, but I did it, and I am certified with about four insurances. So that means, I can see patients, submit to the insurance, and get reimbursed. Well, and I've done that for almost a year, and I have learned that it is very hard to get paid. And there is a whole billing side of medicine that is people's profession to bill or to code, to bill, to, follow up on denials, refusals. Like there's a whole industry of professionals, just the coding and billing side of medicine. So it's got away from me to the point where I'm not getting paid. I don't have the time to go back and fight the denials. I'm finding that it is quality over quantity care. I can't spend the time with my patients that I want to, because I still have to make a living too. And so it's become very clear to me that the insurance model is quantity over quality, because now in my billing realm, if I want to keep going with it, I'm going to have to hire somebody to do my billing and coding, which is what most people do. But then I got to see more patients to pay for my biller, which takes
Mhm.
more time away from the patients I have.
Yeah.
So I decided to create a model for women in midlife that gives them what they need. They get time, they get listened to, they get seen, they get direct access to me. I get to work on their prescriptions, their prior authorizations, their referrals. It's all me, and I get the time to do that. So I've created a type of practice for just women in midlife, focusing on menopause, medical weight management, and sexual health for those women. And it is not the insurance model per se for their visits. They can still use their insurance for um, their medications at their pharmacy, if they're getting lab work done or any diagnostic testing. But as far as reimbursement for my services, it is a cash pay practice. But that allows me the time and
Mhm.
less frustration to do what I want to do.
Yeah, when you think about it, it's like, is there any other industry that exists where the provider, the service provider, whether you think like CPA, bookkeeper, lawyer, marketing consultant, anyone selling their services doesn't know what they're going to actually get paid at the end of the day and how much, like if every bill I sent to a client, they
Uh-huh.
agreed to pay me, I
Uh-huh.
send them a bill, and now it's like some third party is saying, actually, nah, we don't believe you, or justify it, or
Yeah, or there's like a measly little mistake on there, or something's not right,
Mhm.
or they don't agree with, and they're going to deny it. And then going back and finding out why they denied it is one of the hardest things I've found.
Yeah. Yeah, I mean, the policy around medical care in our country is not a new dialogue for sure, but I think I've seen a lot of my own medical providers over the last decade have left the big group practices to go in, the word boutique care, right? Or this
Concierge.
pre concierge premium models, membership models, all of these things, and it's just further, I think, exacerbating the supply demand for everybody, right?
Everybody. I also opened my own practice for my own mental health. So burnout is real for clinicians, and what it is quality over quantity. You're seeing a patient every 10 to 15 minutes, 20 minutes. You're rushing, you're stressed. You don't get to treat the whole person. They
Yeah,
come in with one thing and they have to be seen for that one thing. You can't ask them about all this other stuff and treat the whole person. There's just
right.
one thing you can see them for, and you got 15 minutes.
Yeah, the thing that drives me nuts, and I'm sure a lot
And
of the female listeners on this podcast, the men probably have never seen this in their well visits, but it's the sign that's like, if you're here for your free, insurance
uh-huh.
covered well exam, we're not going to talk about any problems, or
Mm-mm.
we're going to bill you for a second visit. It's
Yeah.
it's it's like
But you
the
can't
site.
build two visits in one day.
Right. Yeah.
So you're going to have to come back for those other issues.
Yeah, it's just asinine. It's really asinine. Um, so I hear what you're saying. This was for you. People use the word lifestyle. You said your mental health, but it was like how you saw being a practitioner was these drivers for building this business. So let's talk a little bit about like the meat and potatoes of what you're delivering, because I I am your target market. Newsflash, world. You've even on your website, you say you are your target market. It's
I
like,
am my target one.
yes, like, and as a working female, as a business owner, like I have more conversations with my peers who like the term menopause comes up probably on a daily basis.
Yeah.
Every single day, even in my office, whether it's someone having a hot flash and, the fight over the fan, or if it's the brain fog, or if it's the I didn't sleep last night, or like whatever it is.
Hmm.
So walk me through, what are you seeing? What do we need to know
Yeah.
about the kinds of care one can get in your practice?
Yeah. So a lot of women come to me after they've usually been dismissed, gaslighted, blown off, or diagnosed with depression or stress for these symptoms. And so usually when they're coming to me, they're frustrated and they want real evidence-based care that they've heard about, right? Like there's all this menopause buzz and it's getting its day. And they're like, wait, They said I could take hormones, but my doctor said I couldn't. What? They do their own research and they're like, I can take hormones. They come to me and they're like, what's going on? And so the unfortunate thing is there's a huge gap in medical education for women in midlife. So when OBGYNs go to residency, they are lucky if they get one clinical rotation in menopause care. In med school, PA school, NP school, we're lucky if we get a month about menopause care. So there's a huge gap in education in our clinical workforce about menopause and menopause throughout the span of perimenopause to postmenopause. A lot of this stems from, everybody focusing on the mom and the baby, but it also comes from, there was a Women's Health Initiative study that came out in 2002 and said, hormones cause breast cancer and hormones cause strokes and blood clots. They're bad. Everybody needs to stop. Well, that study has been debunked, and the things that were bad that came out of it have been walked back. They have even been walked back by the authors of the original study. And there
Hmm.
were many beautiful things that came out of that study. But there's about a 20-year gap of medical providers that if they didn't go back and learn the up-to-date evidence-based information, they don't know it. And they're speaking from a place of misinformation. And they're dismissing their patients or treating them with antidepressants. And people aren't satisfied with that anymore. So I went back. The Menopause Society is our governing body of medical clinical guidance of menopause care. So I had to go back and study this, learn it on my own, get certified on my own. Nobody paid me to do this. It's not part of any curriculum. I did this out of my own self-interest. And so now I know more about it than most OBGYNs, primary cares. And so a lot of people find me when they're desperate.
Hmm. Right.
Yeah. Or they've had a medical condition like a blood clot and their PCP or whoever said, oh, you can never be on a hormone. Well, that's not true. Let's work through that. So people come to me for, real answers to menopause questions.
Yeah, I think a couple things that I wonder. Are we society, we have the OBGYN,
Hmm.
obstetrics and gynecology, and they get smushed together. And these
Uh-huh.
doctors, are we asking a specialty to know too much about, like, basically birth to death, but for the female body, right?
Right,
Like,
right,
whereas there's specialties of geriatrics and there's specialties of other parts of the body, like in menopause is not it's not like a body part, right? It's a whole set of symptoms or a set of change happening.
right.
So
Exactly.
do you see it changing that this idea, will medical schools separate this at all? Will there be specialists in this the study of this as disease is the wrong word, right? Because it's
Yeah,
normal. So like how where do we go from here if it's not
yeah.
just the Adrians of the world who see it their calling to fill this
Yeah.
market demand?
So, that's where there's this huge grassroots force trying to create awareness. But getting more curriculum in our schools for clinicians, doctors, NPs, PAs. So getting curriculum, and there's a lot of people working on that. But there are, specialties for women in midlife, but I do agree that there could be or should be a separation of the obstetrics and the gynecology because there's a lot of women that don't have babies. There's a lot of people that have a lot of gynecological issues, disorders, diseases, cancers that need their own therapy and their own specialized clinician. So, yes, if I had it my way in the next years to come, there would be a separation.
So when should a woman seek? I understand right now you're getting folks they're at like I need relief, right? So they're clearly like on the way.
Uh-huh.
Is there such a thing as preventing menopause or preventing sort of the negative downside of menopause, or do you have to kind of wait until you're in the throes of it to seek care?
Yeah, there's no prevention. Um, as far as estimating a time of when menopause could occur for you, you might talk to your mother, your aunt, some other females in your family because it can have a genetic component to it. I have a patient whose mom went through menopause at 43 and she's 42, really suffering. It'll probably be this, a little bit earlier than normal menopause. The average age is like 51. So there's nothing you can do to prevent the ovaries from declining in their hormones. They're losing their estrogen, they're losing their progesterone over time. You can't prevent that. But what you can do is understand and be knowledgeable about the symptoms of perimenopause. So when it does start to happen, you don't feel like you're going crazy. You don't aren't confused about what's happening to your body. You know where to get treatment, good quality evidence-based care, not being confused about your body or feeling out of control of your body and confused about the conflicting things you're hearing in media versus what your doctor says. That would be my hope, is that people will
Hmm.
be educated about perimenopause, when it starts, what the symptoms are, so they weren't questioning what was happening to them in perimenopause.
Hmm. So what's next in your practice? Do you have growth plans or do you want to keep this your lifestyle practice where you are the practitioner?
Um, I would love in the future to expand to more of a multidisciplinary practice where maybe I have some registered dietitians on board. Maybe I do a lot of work with pelvic physical therapists, psychologists, that specialize in midlife. So really creating a multidisciplinary practice where women don't have to, go out and cherry pick for things. It's kind of all in one realm for what they need.
Hmm. That's great. So
Yeah.
how are you marketing yourself? How are you getting out there?
Well, I'm doing things like the podcast. So I have a social media. It's at Vita under slash women's health, which I do post regularly, static posts, but I also do give videos that, give you a little insight into real information about menopause. So I am on social media. I'm working on, I have a few lectures I'm giving coming up to women's groups. And just, I really want to get out in the community and be involved and educate and just get the word out. Like anything I can do to network and market is hopefully going to get the word out more to other women to, yes, educate them, help them, and then, of course, grow my business as well.
Right, right. Of course. So I often on this podcast are asking other business owners how they're incorporating AI into anything that they're doing. Is that even
Yes.
in your psyche?
Yes. Oh my gosh, I
How
love
are
it.
you using it?
So, have you heard about these AI note-taking companies? So there's like Freed or Deep Cura or Heidi. So for my practice, I have people sign a consent if they're willing to have their visit recorded by AI, and most people do. And so I have AI going in the background who is recording, of course, the transcript of our visit. But at the end of our visit, they come up with a beautiful clinical note that I put in the chart. So what used to take us forever after a visit to document everything in the chart that was said, the history of present illness, all the labs, the physical exam, and then the assessment and the plan, that was all us, like typing this stuff. And
Right.
now AI does it. And I can go back to AI and say, okay, after the visit, I've got the note and say, all right, I would like to refer this patient to physical therapy to this provider at such and such, could you please create me a referral letter for this patient to pelvic physical therapy for
Hmm.
X, Y, and Z? So I can do that.
That's fantastic.
Yeah.
So,
Or I can say, hey, give me a differential diagnosis for this patient, or what are the ICD codes that go with this patient? Or I can just pick its brain. Um,
hmm.
if I don't like what it gave me, I can go back and tweak it, ask it to do different things. So that is the most helpful place that AI comes in for me for medicine, but I use a lot of AI chat GPT for my marketing materials, for my patient handouts, to help me create things for patients.
Right. Do you see, are the AI tools that you referenced that are for medical
Mhm.
application, do they have layers of security that are different than sort of the chat GPTs in terms of
Absolutely.
like patient privacy and
Absolutely. They're a
that's great.
different entity. Like I would never take my patient transcript or information and put it into chat GPT. That's not a secure platform. These are secure HIPAA compliant platforms of which those notes are deleted. They're gone.
That's great. Yeah, I think that's an important distinction. I
It's
mean, with ChatGPT, like we get those oh, what do they call them? Like brain farts from the the hallucinations, I think is what they call. A colleague and I were talking yesterday. She had a chat create her a, a spreadsheet and the formulas were wrong and it didn't add correctly, right? And I had chat create me a grocery plan or a meal plan and then a
Mhm.
grocery list. And it left things off the grocery list that like the sweet potato, black bean
Yeah,
quesadillas, it didn't put sweet potatoes on the list. So there's errors.
there are.
Do you see errors on the, in your like the human is still the
Absolutely.
verifier?
I reread them. I fix things. It's not perfect. No,
Yeah.
no.
Yeah.
And I go back and I add details. Like it'll miss pertinent information that I need to include in the note that helps me with the diagnosis. Like there's a lot more things that it's clinically not picking up that are super relevant.
Mm,
I think it's part of a conversation, but actually it's super relevant. Um, so I will read the note, but then go back if I need to edit something or add something or change something. I always go back and read them. Yes, for
right,
sure.
right. Yeah, that's great. And I think that's an important distinction no matter what business someone's in. It's like these are tools, they're not
Their tools.
replacing the human mind for
Yeah.
the quality control. Well,
Yes.
Adrian, I always like closing with some fun rapid fire questions.
Okay.
There is no right or wrong, and you can say skip if you really just don't want to talk about it. Um, did you see them? So some
I
guests don't know
did.
what they are. Oh, you know what they are, so you're going to be prepared. So, what is your favorite social media?
Instagram.
Why?
I love the reels. I've got my algorithm going. I learned so much information from it. I really do. There's a lot of good, I mean, for my patients, I give them good quality Instagram accounts to follow, like people I know are giving evidence-based information.
Hmm.
So I'll say, hey, go follow these people and listen to them. And they're fantastic, fantastic. These are leaders in our profession. These are, the groundbreaking, they call themselves the menopause. Dr. Claire Haver is one. She's one of the
Yeah,
most famous ones, but there's a lot of other great ones besides just her. And so I follow those and I love to learn, but I also give that list to my patients.
that's fantastic. All right, Taylor Swift, yay, nay, or don't care?
I'm a Swiftie.
Yeah, me too.
I'm Team Taylor.
Team Taylor, yay. Is there a book you always recommend?
So, not always. I have my favorite right now, which is the new Let Them Theory by Mel Robbins.
Yes.
Oh, I can't quit recommending that. It seems like it's applicable in so many different places.
Yes. So a colleague and I have read it, and so we'll be on our morning one-on-one and say one of us will say to the other one, "But you're going to let them, right?"
Let them, just let them. And just look, that's the 8-year-old kid. That's
Yeah.
the 8-year-old kid. Yeah.
Yeah.
I love it. I loved it.
Yeah.
So I've right now I'm recommending that a lot.
And then where do you want to go on your next vacation?
The Maldives.
Ooh, like one of those overwater bungalow kind
Mhm.
of situations.
Because you were talking like dream it up, right?
It could be whatever you want it to be.
I was going big. Go big or go home.
Exactly.
Yeah, so it's just this amazing atoll, and I'm an avid scuba diver. I love it. Oh, I want to go. And before it's gone, like you hear that, with the sea levels rising, there might
Mm.
be little islands there in 20
So,
years.
any plans in the works to make it happen, or is this still just, you know,
This
on
is
your
a
vision board? Okay. Not
yes.
a pipe dream. Pipe dream makes it sound like it will never happen.
Okay, okay. It's a bucket list item,
Okay. Awesome.
but
Well,
hopefully sooner rather than later.
yeah, I'll get this business churning, and there you go.
And I can work from anywhere. I
Hello.
just need
There you go.
Wi-Fi.
That's fantastic. Well, this has been a lot of fun, Adrian. We are going to link to your website, your social, in the show notes for our listeners. But for those who are listening while they drive and are not going to go and read show notes, where can they find you?
Yes. So my Instagram is at Vida, VID as in dog A, Vida underscore women's health. And I have a Facebook page and a LinkedIn page of Vida Telehealth as well. Um,
Fantastic.
yeah, but my website is just VitaWomen'sHealth.com.
That's easy enough.
That's easy enough.
VitaWomen'sHealth.com.
Yep.
Fantastic. Well, uh, while menopause might not always be enjoyable, having this conversation with you has been. I really appreciate your time today, Adrienne.
You are welcome. Thank you for having me.
Thanks for being here.
Bye-bye.